CEN Test Prep Exam Job Description. Question 1. The most common cause of acute renal failure in hospitalized patients is Option A. Glomerulonephritis. Option B. Acute tubular necrosis. Option C. Renal calculi. Option D. Pyelonephritis. The correct answer is option B. Acute tubular necrosis. Question 2. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A. Hypovolemic shock. Option B. Distributive shock. Option C. Cardiogenic shock. Option D. Neurogenic shock. The correct answer is option C. Cardiogenic shock. Question 3. A patient with a suspected spinal cord injury develops hypotension and bradycardia. The nurse suspects Option A. Hemorrhagic shock. Option B. Neurogenic shock. Option C. Cardiogenic shock. Option D. Anaphylactic shock. The correct answer is option B. Neurogenic shock. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. Which laboratory value is most indicative of acute kidney injury? Option A. Elevated white blood cell count. Option B. Elevated creatinine and BUN. Option C. Decreased platelet count. Option D. Elevated liver enzymes. The correct answer is option B. Elevated creatinine and BUN. Question 5. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because Option A. Cold water causes coronary artery dilation. Option B. Hypothermia decreases metabolic demand and provides neuroprotection. Option C. Cold water flushes the lungs of bacteria. Option D. The mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Question 6. A patient with anaphylaxis develops acute respiratory distress, wheezing, and hypotension. What is the priority medication to administer? Option A. Albuterol nebulizer. Option B. Intravenous diphenhydramine. Option C. Intravenous corticosteroids. Option D. Intramuscular epinephrine. The correct answer is option D. Intramuscular epinephrine. Question 7. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents Option A. Uncompensated respiratory acidosis. Option B. Compensated respiratory acidosis. Option C. Uncompensated metabolic acidosis. Option D. Compensated metabolic acidosis. The correct answer is option A. Uncompensated respiratory acidosis. Question 8. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates Option A. A damage above the midbrain. Option B. A damage at or below the midbrain/brainstem. Option C. Damage to the cerebral cortex. Option D. A positive outcome. The correct answer is option B. Damage at or below the midbrain/brainstem. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient presents with cramping abdominal pain, distension, vomiting, and high-pitched tinkling bowel sounds. These findings are most consistent with Option A. Gastroenteritis. Option B. Bowel obstruction. Option C. Irritable bowel syndrome. Option D. Acute pancreatitis. The correct answer is option B. Bowel obstruction. Question 10. The purpose of administering surfactant to a patient with ARDS is to Option A. Bronchodilate the airways. Option B. Reduce alveolar surface tension and prevent atelectasis. Option C. Decrease pulmonary capillary permeability. Option D. Increase mucociliary clearance. The correct answer is option B. reduce alveolar surface tension and prevent atelectasis. Question 11. Pulsus paradocus is a classic finding in which condition? Option A, cardiac tamponade. Option B, pulmonary embolism. Option C, aortic aneurysm. Option D, congestive heart failure. The correct answer is option A, cardiac tamponade. Question 12. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive 4-fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option B, keep the patient NPO and provide aggressive 4-fluid resuscitation. Question 13. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects option A, open-angle glaucoma. Option B, acute angle-closure glaucoma. Option C, a conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle-closure glaucoma. Question 14. A patient receiving intravenous nitroglycerin for chest pain develops severe headache. The nurse should option A, stop the nitroglycerin infusion immediately. Option B, administer morphine for the headache. Option C, treat the headache and continue nitroglycerin as ordered. Option D, switch to oral nitrates. The correct answer is option C, treat the headache and continue nitroglycerin as ordered. Question 15. The initial fluid resuscitation bolus for a patient in septic shock, per surviving sepsis campaign guidelines, is option A, 250 ml of 0.9% normal saline. Option B, 500 ml of D5W. Option C, at least 30 ml/kg of isotonic crystalloid. Option D, packed red blood cells to achieve a hemoglobin of 10 g/dl. The correct answer is option C, at least 30 ml/kg of isotonic crystalloid. Question 16. The emergency nurse should have a high index of suspicion for an occult eye injury in a patient with option A, a scalp laceration. Option B, an orbital wall blowout fracture. Option C, a nasal fracture. Option D, a mandible fracture. The correct answer is option B, an orbital wall blowout fracture. Question 17. Which finding on end-tidal CO2, EtCO2, monitoring indicates successful endotracheal intubation? Option A, the EtCO2 of 0 mmHg. Option B, persistent EtCO2 waveform with each ventilation. Option C, PtCO2 of 50 mmHg. Option D, a flat line waveform. The correct answer is option B, persistent EtCO2 waveform with each ventilation. Question 18. What is the priority intervention for a patient with an open fracture? Option A, immediate surgical debridement. Option B, apply traction. Option C, cover the wound with a sterile saline-moistened dressing and immobilize. Option D, administer analgesics. The correct answer is option C, cover the wound with a sterile saline-moistened dressing and immobilize. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. Meningitis is an inflammation of the option A, a brain parenchyma. Option B, meninges covering the brain and spinal cord. Option C, peripheral nerves. Option D, ventricles of the brain. The correct answer is option B, meninges covering the brain and spinal cord. Question 20. Testicular torsion is a surgical emergency that requires intervention within option A, 24 hours. Option B, 4-6 hours. Option C, 2-3 days. Option D, it is not a surgical emergency. The correct answer is option B, 4-6 hours. Question 21. To calculate cerebral perfusion pressure, CPP, the nurse needs to know option A, heart rate and blood pressure. Option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Option C, respiratory rate and oxygen saturation. Option D is central venous pressure and cardiac output. The correct answer is option B, mean arterial pressure, MAP, and intracranial pressure, ICP. Question 22. In a multiple minus casualty incident, the triage tag for a patient with breathing 30/min, no radial pulse, and who does not follow commands is option A, green, minor. Option B, yellow, delayed. Option C, red, immediate. Option D, black, deceased/expectant. The correct answer is option C, red, immediate. Question 23. A patient experiencing a tonic-clonic seizure is in the emergency department. What is the priority intervention? Option A, restrain the patient firmly. Option B, insert a bite block. Option C, maintain airway and administer benzodiazepines as ordered. Option D, obtain a stat CT scan. The correct answer is option C, maintain airway and administer benzodiazepines as ordered. Question 24. Sudden, painless loss of vision described as a curtain coming down over the eye is a classic presentation of option A, acute glaucoma. Option B, retinal detachment. Option C, corneal abrasion. Option D, cataract. The correct answer is option B, retinal detachment. Question 25. Which ECG finding is most indicative of hyperkalemia? Option A, prolonged QT interval. Option B, peak T waves. Option C, ST depression. Option D, delta waves. The correct answer is option B, peak T waves.